after the documentary aired in 2012, I think, I remember seeing an article that somebody called James Silcock had killed himself, and his parents were talking to the news about it. And I saw the article, and I found it sad, but months later, I realized it was him because I didn't know his surname, and I didn't put two and two together. I was like, oh, fucking hell, like he hung himself, or I think he might have suffocated himself. But either way, like, this is a young guy who would not have probably done that if it was never for this drug. And because I've spoken to him online a lot of times, that was the most real it's come for me, to realizing that, apart from knowing myself, that I'm very close to doing it at times. I just felt like, Jesus, this is serious.
Hey guys, what is going on? This is Mark Millick here with the Moral Medicine YouTube channel. So today we actually have our first Post Accutane Syndrome patient who's going to be telling his story, also known as PAS. So Stefan has had PAS for almost 20 years now, and he's here to tell his story. So Stefan, we really appreciate you coming on the channel, man.
No worries. Happy to be here.
Yeah, absolutely. So, Stefan, I always ask the question, what was your life like before you took the drug? But for you, this was almost 20 years ago. You were 16, I think, when you took the drug. So, I mean, do you remember, what your life was sort of like?
It's difficult as well, because until you're an adult, you don't have too much responsibility. So life was probably a lot easier anyway. I was in school up until about 14. If I was to describe myself, I'd say I'm still pretty similar now. A little bit dorky. I had friends. I had a few close friends. I played a lot of football or soccer for any of you guys in America. Played video games. I quite liked wrestling, WWE or probably WWF at the time. I wasn't that academic. I don't know if I would have always been bound for greater things in the future, but at 14, I was very happy and very jokey. I just liked having a laugh and very active and athletic, not necessarily in a talented way, but my health and all of that stuff was on point when I was 14.
Right. Yeah, you were a regular kid, basically.
Exactly. Yeah.
So I'm assuming you took Accutane for acne then, correct? That's typically what it's prescribed for.
Yeah.
Right?
So for me, I felt I stood out a bit in my school because there was really, in my mind still now, only one person who was in my year who had it worse than me. Most people might have had a few, or as I realized after school, some of my friends got spottier at, sort of 17. But for me, I think it was either 14, if not just before, where I started to get spots. I wouldn't say it's the worst that I've seen, because for some people, they will see Accutane as a last resort drug. But I did have acne. I got it on my chest, and it was mostly here. I've still got some light scars, which you can see, which will never go. And if I go into a bathroom where it's very overlit, I don't like looking at myself in that lighting because of it. Sure. They're the least of my worries now. But sorry, I forgot kind of where we were. But
no worries. Yeah. So I mean, you took Accutane. Were you 14 or 16? I think I said 16 at the beginning of the video.
You're largely correct. I was 15, and then I became 16 the month I quit the drug, because I quit the drug a month early, which I can explain why whenever really. But the process for me, I had issues swallowing tablets at the time. I've had a lot of practice with supplements now, so it wouldn't be a problem. But whatever the antibiotics, and I don't know if they'd always work for acne anyway, I'd been prescribed those, but I struggled to swallow them. And at some point, I realized this other person that I mentioned, that was the only person who had acne as bad as me, if not worse, in my year. My mum, who worked at my high school, which is where this person was, had heard that she was on Accutane, and her skin, she was ahead of me in the journey with that. Her skin started to look quite good and clear. And obviously at that point, I'm not aware of any potential risks. All I see is my face, people saying, why don't you wash your face? Why have you got so many spots? I'm waking up in the morning like, oh my God, I've got 5 more. What the fuck? I was pretty desperate, and I had kind of exhausted options with face washes and all different products, and staining my bed sheets with benzoyl peroxide, I think it was called. So then it got to the point of going to my doctor and saying, I want Accutane, or Roaccutane, as we call it in the UK. And they told me, we can refer you to the hospital, and a dermatologist there will examine you and determine if you're ultimately okay to go on it, if you're severe enough. And I had to, at the hospital, I had to take my shirt off and show my back knee, which was pretty bad, and chest acne as well. And ultimately they said, yeah, you've got it bad enough that this is probably going to be good for you in a way. And I imagine on that, my memory's a little bit bad, but I guess I came back one or two more times. I was informed about some side effects with Accutane, but it was an A4 piece of paper, maybe two-sided, but ultimately some of the effects I'm struggling with now weren't listed. And similar with finasteride, the side effects were either massively underplayed because people just don't report them officially, or I'm just very unlucky because it was like minus 1% for most of the stuff. And I got so many side effects while on the drug and more after. Yeah.
No, that's incredible because, well, number one, let me ask you, did they tell you of any possibility of persistent side effects or just on the drug side effects? Like, they say
they were very adamant, and I like to believe that this is what they actually believed rather than them knowingly, just wanting me on the drug for whatever reason. They told me, if you get any side effects, you can come off. And they still say now, I'm pretty sure, it's out of your system within a month of coming off. And so, later down the line when I was really struggling, I had to come off the drug early. I thought, in a month I'll be fine. But, 19 years on from when I first started taking it, I'm not fine.
It's unbelievable. I mean, they tell you the same thing with finasteride because I think the half-life is like 8 hours. So like in a week or two, it'll be out of your system. Yeah. And any, side effects you deal with, in theory will go away. But you mentioned something that we deal with as PFS sufferers is that your side effects got worse. And I think you developed new side effects after you came off. Is that correct?
Yeah, that is true. There's a number of problems. There's a few that I would have to be open to. Maybe they're, let's say, stress-induced or unrelated. But there were some that happened quickly after, where I had a crash from stopping the treatment, where I was like, what the fuck's happened to me here?
So let me ask you this. You took it for how long? Was it 5 or 6 months? Or
I prescribed it for 6 months, which I think is very typical. I don't remember the dosage because people have asked me that a lot in the past, but I think it would have been 50 or 60 milligrams, which is fairly common. But
I gotcha.
5 months into it, I determined my skin was looking quite a lot better at that point, but I was really struggling. I just wanted to come off it. And I wanted to come off it before 5 months, but my family were sort of, well, come on, it's not much longer, you'll be okay. They didn't know what was going on in my head from it. So I persisted despite my body screaming that, no, dude, this is not good for you. And probably too late at that point anyway.
Was it mainly psychiatric side effects? I mean, depression, anxiety?
Yeah, well, I had a few. I can tell you a few I had. Some that weren't, a big deal, but were bothersome still. I had a lot of nosebleeds. I had to keep coming out of classes with tissue shoved up my nose, which is weird. But again, it's like not the end of the world having that, I suppose. But you question why it's happening.
Right.
But yeah, I think I was basically experiencing psychosis. And I want to clarify for anyone watching that I'd never had any mental health issues at all. So I knew it was the drug even before having Google and all these results that people can find now. I was just so angry. I wanted to kill people. I was playing sports, and if someone who was better at me at football would nutmeg me where it goes through your legs and it's a bit embarrassing or whatever, I was like, I'm gonna fucking kill that guy. I was like, Jesus Christ, I'm not normally like this. Why am I so angry? And it's like one of my mum's best friends, who was kind of like an aunt to me in terms of, I was very close friends with her son. She would just sort of make a comment if we were out together. We would often be out together in a group of 4. And I sort of loved her as family in a way. But I just felt this snappiness in me that I had no control over, like, fuck you. I remember losing my shit a few times.
Yeah.
And crying, and I was like, I don't even know why I'm crying. I'm just like, Jesus Christ, there's something up with me.
Right. Yeah, absolutely. I had the same experience when I was on finasteride. I didn't attribute any of my symptoms to finasteride at that time because I had done research and it said nothing about having emotional outbursts. But I was angry too. I lost my emotional control over really small things, and it was horrifying. But you already connected that to the medication, so you came off a month early then.
Yeah.
So I guess my question to you is, when you came off, what happened?
Yeah, so I remember binning the remainder of the pills and being like, screw you, I don't want to be on you anymore. And again, I had a computer, so I hadn't Googled anything at this point.
Right.
It's hard exactly to remember the timeline, but ultimately I was just waiting. This was around when I was finishing high school, which is maybe different to high school in America. So I was, basically, I just turned 16 and I'd finished school. And in the UK, most people go to sixth form or college. I went to college after. But I remember in my head, this sticks out. I was at my prom a few weeks after school finished, probably around May or June at the end of the term. And people were saying to me, dude, cheer up. Like, you look fucking miserable. And I felt like it's how I feel every day now, really. But this was the beginning. I was like, what's going on? It was the depersonalization, extreme depression, just a dark, heavy cloud, no energy, just like the life had been sapped from me. And when I was on Accutane, I don't think I had extreme fatigue. I had sweating. My face went really red. I got injured a lot. I got this toe infection. But it was when I stopped it where I crashed and my body just kind of like felt like I was 90 years old, which is the way I've always described it. Just like all the energy's been drained from my body.
Right. So physically, you dealt with the physical issues, you had the neurological issues. And it's been, so when was this? 2005, roughly? 2006?
So I took Accutane 2005, came off it in May 2006. So we're talking nearly 19 years.
19 years
It's
almost.
crazy for me to say that because it doesn't feel it should have been that long.
So, Stefan, are you still dealing with the same symptoms now that you were when you first came off it?
Yeah, pretty much all of them. I still get nosebleeds every several months, just randomly. Always this nostril. I could maybe have it cauterized, but again, it's kind of not bothersome in the grand scheme that I'm like, I just live with it. Yeah. I have chronic fatigue. Do you want me to? I've listed my symptoms.
Yeah, dude, if you can just list them all out, if you don't mind.
Yeah. So the rage thing, that was definitely extreme on the drug, but I would say I still am very snappy, and it might just be because I'm living this kind of, I'd say half-life, but it's not even a half-life. Let's just be honest, it's like 10% of my life, and I'm still having to go about, and people don't understand because it's invisible, and I look pretty much the same, and people that have known me don't really get it or believe it, and it's just very isolating. So that could be where some of the anger comes from, is knowing that, just the regret, and I try not to like hang on to it, but there are times like bringing this up now for me where I'm extremely angry that this happened to me and that it continues to happen to people, and that 100% the makers of the drug, Roche in this case, are obviously aware that they do this to some people, and I'm willing to accept that I might be in a minority, but even so, there are people who are typically very young, like I was when I took it, whose lives are fucking ruined, and people that have killed themselves because of it. So, there are people making billions or trillions, who knows how much money off it. And I'm sure they sleep in a big queen-size bed, but I've always been a moral person. I just couldn't do it. But I'll read out some of my other side effects. So chronic fatigue, I mean, that's just constant. If I have a day or two where I have a bit of energy to watch telly or play a video game or play guitar, that's a good day for me. But more so than not, I feel absolutely exhausted. And I look in the mirror and I look exhausted, and I don't always sleep well. I get insomnia at times. Dizziness, I get very dizzy and just feel detached. Dark circles under my eyes, I've noticed over the last few years. Again, it could be stress and other stuff I'm dealing with in my life, but I don't look healthy. It might not come across here, but sometimes I see myself, particularly when I wake up in the morning, and I just think, Jesus, like, how are you still alive?
I get that.
Cognitive issues, so I've just put confusion. I forget words, just simple words that I know. I sometimes worry I've developed dementia or the early stages. It can be very severe, like just very confused. Struggling to concentrate at work or during conversations. Social anxiety, which I was always a little bit shy and sensitive as a kid, but I think there's just so much that I just don't feel normal. I feel broken, and I'm jealous of everybody who hasn't had this happen to them. So I think I'm just very insecure about all of it, and that's where a lot of the social anxiety comes from. One of the side effects is dry eyes, so my eyes can get really red, especially if there's like aircon. And I see myself in the mirror sometimes with these like red bloodshot eyes, and I feel like I look crazy. So I've got insecurities over stuff like that. So when people are making eye contact, I'm thinking, are my eyes bloodshot right now? So it's a bit of a paranoia about that, which has led me to withdraw from a lot of social activity. My liver, and your liver is checked while you're on Accutane, or at least it's meant to be checked every month, I think. Mine was checked like twice. I don't think they checked it more, but I've had numerous blood tests over the years. There's nothing really that shows up on there apart from Gilbert syndrome, where I can go a bit yellow, jaundice. But regardless, if I try and drink alcohol, because that's a very strong part of UK culture or British culture, people are like, why don't you drink? And I don't want to tell them my life story, so I just say it doesn't make me feel good. But even in my early 20s or late teens, when I first started going out with friends, which is the normal thing to do, I would drink less than them, and I'd be ill for 2 days, throwing up, and they would be out the next day feeling fine. And that's only got worse with age. I've tried drinking a few times, and it just makes me feel really depressed and tired and just worse in general. Anhedonia, not really having any enjoyment, like thinking, what is the point? Emotional detachment, I've seen you talk about in your video and interviews. Just something bad could happen. I was at my granddad's funeral years ago, and he was a great guy and I loved him, but my sister, my cousins, people were crying, and I kind of like made myself cry because I felt like such a freak for not being able to express emotion. I know some people will say people handle grief differently, but no, that's just like, I knew when I got the call that it died that I was kind of concerned that, am I going to feel anything? And I kind of didn't, like, and I should. And I used to cry a lot and be sensitive as a child when I had a normal brain, but this drug's done something to it. I mentioned the dry eyes, but also eye floaters, which are prominent. Some people might get them and go, oh yeah, I sometimes notice them if I'm outside looking at the sky. I see them indoors all the time. My vision is actually pretty clear, so I don't need glasses, but I wear these blue light blocking glasses at work just because the frames kind of stopped me noticing the eye flows as much.
Okay, yeah, fair enough.
So I've tried to make adjustments, but I'm often wearing sunglasses outside because my eyes are just so sensitive to the light, and the floaters are everywhere. Especially, I go somewhere now like a beach, which should be a lovely place to go, and I look out at the horizon and it just looks awful. And the visual snow as well, which is like the constant. But the eye floaters have driven me a bit crazy at times. Dry mouth, that's awful. My mouth is particularly dry in the morning. I always have a glass by my side, my bedside table, but I have to drink a lot. And that was a prominent symptom. Everything was dry while on the drug, and that unfortunately never went away. But it was particularly bad on the drug. My lips would peel. I had to put Vaseline on, or, lip balm every hour. I don't really have to do that anymore, but there's still like a lack of sebum production, which is probably why the acne's gone, because it's killed those cells or whatever it's actually done.
Right.
Gum recession's been a recent issue. I actually saw a finasteride guy on your channel mention this. I think the one that took it for 1 day, and it fucked him.
That happens a lot to people, actually. Believe it or not, I've talked to many people who have gum recession, which is insane.
It is insane. I had Invisalign, so for a while I wanted to believe that maybe I shifted my teeth and it did that. But earlier this year, I had to pay about £1,200, which is maybe $1,500 for a gum graft. And I'm so paranoid about it. I know this is years on, but I know it's all Accutane, man. Like, I'm looking in the mirror every day thinking it looks worse, like my teeth here and the gum line here. And they're telling me, like, you might be brushing your teeth too hard. When the light on your electric toothbrush is red, that means you're doing it too hard. It's like, I know how to brush my teeth. I'm not fucking stupid. Like,
right.
So I don't know if it's the dryness, which I can't control overnight, really, or just damage to every section of my body from this medication. But that is something that worries me a lot, because I'm 34 now, but in 20 years, how many gum grafts am I going to need to keep my teeth? I've still got quite a few.
Oh, keep going, man. No, long. Appreciate it. It's crazy.
A lot of digestive problems. I'm always bloated. Intolerance to a lot of foods. Nuts and stuff seem to give me headaches. Anything high in fat seems to really mess me up and make me brain foggy. dairy, which maybe people aren't really meant to have because it's kind of for cows, I guess. But dairy, I quite like chocolate and cheese. So I noticed that actually makes my problems worse. But I'm not super disciplined with my diet. Like I know some people can be always constipated, which again, I didn't have this stuff before. And I've spent money on nutritionists and had like stool samples and all of that stuff. But ultimately, nothing's made a difference. I could never go gluten-free, so I never really tried that fully. But it gets to a point, it's like how much more would I have to do? I've tried lots of different stuff. It never really goes away. I drink a lot of water. You look up advice for constipation, it's like fiber, water. It's like I've tried everything beyond that. Problems with this one's a bit embarrassing, but I don't care at this point. And this is what I wanted to say for anyone that's afraid to speak out, because some of these symptoms are embarrassing and maybe people would worry about their friends or family or people they know watching the videos, or even strangers judging them. Like, this should be embarrassing for the people that have caused it. Like,
100%.
This could have happened to anyone that took it.
100%. Absolutely.
But problems urinating, I sometimes feel like I need to pee every 20 minutes and barely anything comes out. I struggle going. At one point I thought I'm going to have to get my prostate checked because like this is really taken over my life now. I get worried when I go to see live bands or I go to the cinema or the theatre, whatever. Oh, there's going to be a queue for the toilet. What's the toilet going to be like because of this problem? And when I do go, it's like, oh, it's like that much coming out. But it feels like my bladder can't hold anything at times.
Yep.
Which could be a stress thing. It could be from tension around my pelvis from the amount of stress that I'm dealing with day to day because of all this. I don't know, but I've looked into that a lot and I haven't been able to improve it, unfortunately. This one's pretty big and pretty common and won't surprise you at all. Libido is just non-existent. There was a point where sorry, I was just being my side. No
worries.
In my relationship, there was a point where I had more issues than I have now. I had, and again, I'm hesitating because it's just a bit personal to talk about.
It's okay. I completely understand.
Yeah.
No worries.
Like, I couldn't ejaculate and I couldn't feel anything, and it would take like an hour, and it'd be like I'd just give up. What's the point? I can't feel this anyway. It won't feel good when I
numbness, right? I mean, you can't feel a single thing. I have the same thing now. It's crazy. I don't enjoy sex at all. It's horrible.
Sure, that one has got a little bit better, and I don't know if it was partly because I stopped watching porn and masturbating. Not that I was like some addict to it, but it did help. And the problem for me now is that I can go weeks without being in the mood at all, and unless something was like sprung on me, then I might get in the mood. But apart from that, there's no sort of spontaneity in my body to be like, I'm a young man who should want to not necessarily procreate, but like that's what the body wants to do normally if it's healthy. So that's something that ruins your self-esteem as a man. And I'm in a long-term relationship now, but there have been points where I was dating people, and I would always worry like, oh, when it comes to that, it's going to be game over. And sometimes it was like a couple of embarrassing moments where I just never saw them again. And that's partly my fault for not just being open and saying, look, I'd like to get to know you better rather than, and I wasn't this person going out, having one night stands and that, but I wouldn't be able to do that even if I had have wanted to. I've just put overall feeling weak and emasculated. My testosterone has come back low a few times, and by low, it has actually been out of their range on the NHS, the UK system.
Okay.
But the range has been adjusted over the years. It used to be between like 8 and 35. Now it's between about 8 and 29, that's a different reading to you guys in America, I think. But essentially, my last result, which was recent, was 12, which had gone up from the last one, which was 9. But that's still extremely low for someone who isn't 90. And that's the problem with that range. That's going to encompass people who are really old and probably don't need to, be thinking about it at all.
Right.
And I just sometimes there's certain things about myself where I just feel like I'm more boyish than a man. A lot of people say I look younger than I am, even though sometimes I feel, because I've gone a bit grey now and I've got lines on my head, I sort of look a bit young and old at the same time. I don't know.
That makes complete sense to me. I don't want to cut you off there.
No,
I've had people, it's almost like I aged and de-aged at the same time. My face became more boyish, more soft, almost more feminized, but it also kind of sunk in. It became more gaunt at the same time, which made me look older and younger at the same. I don't know if that's what you're referring to, but that's exactly what I go through. It's crazy.
I feel my skin looks a bit more kind of off color, like a bit grayer. And the thing is as well, a lot of women's products, or not just women, people that want to use moisturizers, the expensive ones use retin A, which is a form of basically Accutane. And I'm sure if you do that enough, it can screw you up as well. But that's a de-aging thing. So it's kind of weird. But it does explain the logic as to me saying that, rather than, it sounds a bit weird, like I look old but young as well, but kind of do.
I've heard that from so many people. You're not alone in that. A lot of people have talked about that, including myself. So yeah, I completely understand where you're coming from.
Yeah. I've got a few more. We're nearly there.
No, keep going, please.
I already mentioned unable to tolerate alcohol, but also caffeine. I just feel like my body's so fragile in general. There are people, most people really, that drink coffee every day to get by, to get stuff done at work.
Right.
And if I have one cup, I can't sleep. If I have a cup in, let's just say for lunch, I've not been a massive coffee drinker before, but I quite like a latte with a little shot of syrup in.
Sure.
Maybe a pumpkin spice latte, but anytime I've done that, I can't sleep, and it just makes me feel like, oh my God, I'm so anxious. It's like my nervous system's already so hardwired for agitation and like jumping at noises that just, I have to avoid it entirely. Even decaf, which you would think it doesn't really contain any at all, but I've even had decaf and it does something. So I don't know if it's the coffee bean rather than just the caffeine part, but ultimately coffee is not going to be something I can enjoy. Oh, this one's quite recent, but it's really bothersome. It's really pissing me off a lot lately. So I've got problems with my jaw now. And I've spoke to people in the past about Accutane, and they've mentioned this, and I thought, I haven't dealt with that, so at least I don't have that problem. But now I do. So when I chew anything like a bowl of cereal or a baguette, where your temporalis muscles are used, they will kind of protrude for about 5 or 10 minutes. And I first noticed this. I was just eating, it was a baguette actually, and I just felt this tension around here, and I felt my temples. I was like, oh, they feel like swollen. I looked in the mirror, and I just looked like a freak. And that's been happening for months now, and it hasn't gone away. And it could be that I'm clenching my jaw at night. I have had quite a lot of stress this year. Me and my partner are having to find somewhere else to live around Christmas suddenly. My dog died. It's just been a tough year.
Sure.
But it's all the stress I think's added to it. But I'm very aware of to the point of being paranoid about it. During the day, I'm like, oh, am I clenching? And I'm never clenching. So it must be something I do at night. But I get these spasms as well quite frequently where my muscles just going like that. It's very distracting and very annoying when it happens.
Yeah.
And I have damaged my teeth. And again, if that is a factor, it could be that's contributing to the gum recession. And that's just something I'm so worried about now. And then the last thing I've really written is just overall feeling kind of trapped in a nightmare, waking up being like, I can't believe I'm still having to live like this. But also that numbness to it, where it's like I'm so used to living my life like this. If anyone else who lives a normal, healthy life had to wake up feeling like this, they would notice how off it is. But because after 18 and a half odd years, I'm so used to it, it's only really times where it hits me and I realize, like, around Christmas or New Year's, I'm like, another year's gone by and I'm still completely broken.
You almost kind of adapt to it in a way, but it's still always painful to be going through life like this. You know? I mean, I'm always in constant pain, whether it's emotional or physical. Stefan, you went through a lot there, man. I really appreciate your thoroughness, obviously. And it's tough to open up and talk about some of those things. I'll say this. A lot of what you experience overlaps significantly with post-finasteride syndrome patients in particular. It seems like people who take, finasteride or Accutane who get hit with this, they get hit extremely hard physically. Talk about some of the facial changes and the jaw issues and the gum issues in particular. I've had issues with my gums and teeth as well.
Oh.
Yeah. What's the? I don't know what this is called. You have gingivitis, and then what's the step up from that?
Periodontitis. Or
periodontal disease.
Yeah.
Periodontal disease. I got diagnosed with that about a year and a half ago. Dude, I use a Sonicare toothbrush. You know, I mouthwash twice a day.
Me too.
I was shocked, and I was like, how do I go from having great teeth, no cavities, to all of a sudden a year and a half after quitting, finasteride, I got periodontal disease. So yeah, I'm 100% convinced it's connected, it's related, because nothing else changed outside of me just coming off the medication.
Yeah.
But man, you got so much going on there. My heart goes out to you, Stefan, because you've been dealing with this for almost 19 years now, and I commend you for your strength, man. Your voice is going to make a tremendous difference with this movement, so I really appreciate that. I'm assuming have you gone to clinicians or doctors about this, even just recently, just to address some of these issues, to see what they have to say?
Yeah, so in the early days when I was still young, my mum would come with me, and it used to be quite frustrating because my mum would kind of speak for me and say, because I was so shy, she would speak to the doctor and say, he thinks it's this drug, but I mean, it couldn't be, could it? And of course, the doctor, whether they know or not, are going to say, well, I can't be admitting liability on behalf of these drugs that we have to push on people. So, And so numerous occasions I've had blood work done where I've started to think I feel worse than ever. Like I need to check maybe there is a vitamin deficiency or my iron or whatever. And it's so frustrating. You would think most people would get a blood test and be like, oh, I don't have cancer or anything. But you want something on paper to say this is why you feel bad. And I mentioned the testosterone. My thyroid's been out of whack before. So I leech onto that. Like, oh, maybe I just need treatment that'll fix it. It's like, no, like this is every single, apart from like, I don't know, walking about, my legs, I guess, are okay. But it feels like every single endocrine system in my body, thyroid, adrenals, all that stuff, have been affected. And because I've been watching your videos about finasteride and kind of thinking, why do they cause essentially the same problems?
Right.
I'm no scientist, but the whole 5-AR inhibitor thing, I was just reading through on Wikipedia and seeing the effects that 5-AR has. And like it mentioned how when you're growing as a baby, it helps with your gums and your liver and your adrenals and everything. It's like, well, it could be that simple that it's this one system that's kind of been shut down. But it affects so much.
The thing is, I mean, so I think a lot of this can be connected to 5-AR or, androgens or the androgen receptor. I mean, like the androgen receptor is responsible for so many aspects of the human body and your functioning, right? So you mentioned like the gums, your ability to build muscle, to think, to not have brain fog, to sleep, all these different things. So I really think that there obviously is a serious overlap. It may very well be the same mechanism as well, for PFS and Post Accutane Syndrome. And especially after hearing your story, I haven't spoken to too many people who have Post Accutane Syndrome. Your symptoms are identical to PFS symptoms, obviously. And I think something I really try to highlight here, because I'm going to say this again, you've had this for almost 19 years. There's always this narrative from people that, people will get better over the course of time, right? Just give it a couple of years, your body will eventually rebalance. That's not the case for everybody. No. I've talked to people who have had PFS for 20 years. In your case, you've had this for almost 19 years.
Yeah.
I think that's actually a little more common than we give credit for. And that's why research is so necessary, because we got to figure out what's going on here. And you also mentioned too, you go to doctors and you have blood work done. You pray. You actually pray that they find something.
Yeah.
I've gotten MRIs done. As crazy as it sounds, I pray that they find a brain tumor in my head, because then I can at least point at something and attribute it to the neurological issues I've been having.
Yeah. Yeah.
And that's such a weird thing, right? I mean, to go to a doctor and to have them say you're fine, we found no anomalies on your tests. It's heart wrenching when you're dealing with the symptoms, obviously. So, It's insane, Stefan. I mean, one of the questions I ask here, which you've actually kind of pretty much, touched on and elaborated on, was how has this affected your life? It's affected everything in your life, your relationship.
There's not a week that's gone by since the drug where my mouth's dry now. I should have got a drink, but we'll crack on.
That's why I'm always drinking my water during these interviews. My mouth gets dry so easily.
Yeah. There's not been a week that's gone by in the last 18 years where I haven't considered just killing myself.
Sure.
To end it. And people don't get that. And on the odd occasion, because it's quite rare, where I really kind of break down and I'm telling people I don't want to fucking be here. like, this is just how he is now. Like, it will pass. But there are times where I'm like, how have I dealt with this for so long? And I remember in the early days for me, I would read stories because Accutane's been on the market since 1982, I believe. And it was a cancer drug before. And they realized it helped people's acne clear up. But it was a chemotherapy drug, essentially. Which, you know, if you've got cancer, maybe you want to risk taking it if it might save your life. But for acne, even if you've got bad acne, which can ruin your life a bit at the time. But I remember those days, I would see people talking about they'd had this stuff for 20 years. I was like, oh my God, I can't believe that. But now I'm one of those people that's just stuck it out. And time is non-existent in my head now. Every day just feels the same. I forget what month is most of the time now, or what I'm even doing. Like, there's just this one life before, and now this is just me making the best of what I've got. But it's really hard.
I really appreciate you opening up about that, Stefan. That's not easy to talk about, obviously. And I think this is what I try to explain to my friends and family, because there are times where they say, oh, you're having a good day. It's like, no, I'm not having I'm having a day where I can tolerate my symptoms a little bit better. I wouldn't label it as a good day.
No.
I can just function a little bit easier today.
Yeah.
And you talk about like the suicidal ideation. Look, I still deal with that myself. It's always sort of lingering because I'm always in so much pain, whether emotionally or physically. And I try my best to maintain the discipline and not think about how my life was just 4 years ago before I took the medication.
Yeah.
But just the anhedonia, the physical body changes, for me, the sexual issues, you as well.
Yeah.
The inability to connect with people. I mean, all that compounded. I mean, this is suicide fuel right here.
Of course it is, yeah. It's completely understandable. And people who, you know, don't understand depression in general will just freak out and be like, oh, there's a phone number you can call for that. Call Samaritans or like a helpline. But I have done that in the past. I've gone to multiple therapists and that to try and like keep myself alive. But it gets to a point where it's like, what good will that do? I know, like, unless I can get better, I'm not going to be happy. Like, this will always be hard, and that's just the fact. And no one can tell me otherwise at this point because it's been so long, obviously. But it's just difficult because, of course, there are people that, let's say, get cancer or they get a hard life. They get some bad cards. That's awful as well. But this is just so difficult because while I try not to, because it's not helpful, I try not to think, oh, if only I didn't take the drug. The fact is, if I didn't take the drug, my life would probably be, I maybe wouldn't be so grateful because I wouldn't know what I had. Like most people drinking, poisoning themselves in a way, I would just have a normal, decent life. It's literally anyone could have taken this, and if they're predisposed, that's the word, to its effects, like, it's just not meant for human consumption for a lot of people. And like you say, some people might not get hit so quick, but at some point, if they go on it, I've heard as well, like, people have gone on Accutane once, but their acne came back, went on it again, and then after that, then they're fucked. So there's just no, and we don't understand at the moment exactly how it's happening. So the mechanism is just completely bizarre. Like, why? I've met people in my life who are like, oh, I took that drug, so, you know, I'm okay. And I believe them, but why me? Why other people? And some are just fine.
I ask myself that every single day because I know people, man. I got friends who take finasteride. I know people who have taken Accutane who didn't sustain any type of permanent damage after they came off it. There is obviously some type of predisposition we must have, obviously. And I tell myself too, Stefan, the way I kind of cope is that there are multiple avenues to getting this, right? Whether you take finasteride, whether you take Accutane, whether you take saw palmetto or an SSRI, or even other medications for that matter. I don't think I don't tell myself that, you know, this was all contingent on one small decision I made, which was to take finasteride. If I didn't take finasteride, I probably would have taken something at some point down the road, you know, that would have exposed me, you know, to having these issues, obviously.
Yeah.
And that's where I kind of make it's easier to cope that way, where I tell myself it wasn't just contingent on this one small decision I made, right? This is probably going to happen at some point.
Yeah.
That doesn't make the suffering any easier, obviously. No. And this is where, I mean, you talked about people who have cancer. I mean, I try to compare my situation to people who I guess have it worse. I mean, suffering is kind of relative, right? But with cancer's recognized. There are treatments for cancer. You get sympathy and understanding from people when you have cancer.
Yeah.
You can I don't want to sound insensitive. You can find a way to cope, I guess, with cancer, because a lot of the times, you know, your brain still works. You can go through cognitive behavioral therapy and you can talk to a therapist. With this, I've gone to therapy and it's like, well, try these little exercises or try these tools. It's like, you don't understand. There's nothing going on in my head. There's not even elevator music. There's just nothing. It's like being perpetually zoned out.
Yeah.
So just talking about this isn't going to help. And I'm a big proponent of therapy. I used to, you know, I went to therapy at one point when I was in the military because I went through a bad breakup.
Yeah.
Dude, it was awesome. I talked to a therapist on like 5 or 6 separate occasions and it was free. And I just walked out of there after an hour of talking to a therapist feeling on top of the world, you know, because your brain starts to rewire itself when you talk things out.
Yeah.
But with this, there's just some deeply rooted neurological disconnection there where even therapy doesn't at least help me or help you. I mean, maybe it can help some people. I'm not discouraging it.
Exactly. And that's the thing.
I get what you're saying.
So difficult now because, you know, again, 18, 19 years, I've tried different forms of therapy. I went to one once where I thought I'm going to give it a go again, and I'd misunderstood what the therapy was. And it was one where all they do is kind of mirror you and act really sympathetic and go, oh, that's really horrible. How did that even... I was like, I don't want to talk about my shit because it's not going to fucking...
Right.
And that's why it becomes so difficult. Is like, people don't know what to tell you. That's when you realize, or I realized a long time ago, that my parents or no one's going to save me with some magical advice, because they're like, I don't know, you've tried antidepressants, and like for a week or so, I tried sertraline or Zoloft.
Okay.
And I don't know if just my body, like you could argue that because of Accutane, I was so like prone to being afraid, that placebo effect and all that. But like, I had these night sweats. My brain felt like even worse. I couldn't sleep. And I was like, I'm not doing this again. Like, this is not a solution. And I don't think I told you this in the emails, but back in 2012, we have something called the BBC in the UK. You may have heard of it, but
very familiar with them. Yeah.
The BBC had a channel called BBC Three. So it was pretty popular. And I was contacted because of some YouTube videos I did at the time to be in a documentary about Accutane, the only documentary I think that's ever been done about it. Okay. And the director of that series, or not series, documentary, is a one-off show, like an hour long. His son had killed himself. So he was trying to understand that. He didn't leave a suicide note to say, I'm doing this because of Accutane. But he had talked about Accutane multiple times, written stuff, said things like, I can't even write the word. It's that painful, which I get. I hate saying its name. It's like, just reminds me of all the pain. But he went on an SSRI shortly before, and I feel because that can make you more agitated potentially while it's affecting you. And I didn't get past the few weeks where you're meant to then feel a bit better, but that might have pushed him over the edge, literally, because he was found at the bottom of the cliff, and no one saw him throw himself off. So it's always like, oh, did he might have been a bit drunk, but no, he'd been battling for years and years.
Sure.
With the effects, sexual dysfunction, and all that shit.
Right. I think I've actually seen that documentary, or at least I've heard of it, because it's like the only documentary, like you said, that's been covered on Accutane. I think, BBC. So I'm pretty sure I'm at least somewhat familiar with that story. It sounds familiar. Yeah, it
was called Dying for Clear Skin, which was a pretty clever title.
Yes, okay, that does ring a bell. Yes, I have at least, I've seen parts of that.
And it was, they had to kind of be even. So there was someone talking that Accutane had really saved their skin. They felt good, didn't get side effects. And obviously that's true for them. And then I was the guy who was speaking out against it. And then another guy who I was in contact with at the time was finding alternative treatment. And he never took Accutane. And at the time he thanked me, because maybe he would have been okay. But he fortunately believed that it was a genuine risk, because a lot of people will dismiss it because not many of us are talking about it. But what I wanted to mention as well, because this hit home for me at the time. So there's a forum that isn't really used much now, but back in the day there were hundreds or more people. There's hundreds of pages. You'd spend weeks reading it on acne.org, a forum that I created a post just looking for help, trying to figure out a way to deal with these side effects, and more people joined. At one point we felt like we were getting somewhere in terms of different supplements, but ultimately nothing really worked. But there was a guy in that forum called James who he had developed various like skin issues. I think dermatitis, or like he had like a really itchy scalp, really dry skin, and he had all these other side effects as well. He started to, become a recluse, stopped working, which I understand why a lot of people would do that. It's easier in a way if you feel you maybe can do that, albeit for only so long.
Yeah.
And at one point I said to him, because he was like, I might kill myself tonight, I said, if you want to speak to someone to feel less alone, here's my number. And I didn't hear from him for a while. And then one morning I was waking up tired or hungover or whatever the situation was. It was an unknown number, and I said, hello. And he said, hi, it's James. And at that point I was like, I don't know who James is. That's a common name. I got friends that are called James. So I said, sorry, who? And he hung up. But then I realized it was him. But what made me upset, because he was one of the people in our kind of small gang really trying to fix this shit. They knew that I was in this documentary, and we all had hope that this would get the word out. They shortened a lot of what I said about these side effects. They pretty much made it about depression and sexual dysfunction, which is fair enough.
Like they always do, though.
Yeah.
It's ridiculous.
Yeah, it's kind of the tagline. But yeah, there was a lot of filming, and like 5 minutes went in. But that happens for telly. But after the documentary aired in 2012, I think, I remember seeing an article that somebody called James Silcock had killed himself, and his parents were talking to the news about it. And I saw the article, and I found it sad. But months later, I realized it was him, because I didn't know his surname, and I didn't put two and two together. I was like, oh, fucking hell, like he hung himself, or I think he might have suffocated himself. But either way, like, this is a young guy who would not have probably done that if it was never for this drug. And because I'd spoken to him online a lot of times, that was the most real it's come for me, to realizing that, apart from knowing myself, that I'm very close to doing it at times, where I just felt like, Jesus, this is serious.
Stefan, I appreciate you sharing that. That's obviously not easy to discuss and talk about, and that's traumatizing in itself. And I think for people who are suffering with PFS and PSSD and PAS, we're surrounded by pain, and we're surrounded by suffering, and we're surrounded by death and suicide. I mean, I hear of suicides pretty frequently in our communities. And this is how we live our lives. You know, we have our own suffering. We hear of other people taking their lives as a result of this. I mean, this is not a sustainable way to live. I mean, this makes living very, very horrendous. Yeah. And I've had two people since I've gotten into the community about 2 years ago who have taken their lives. I know of two people who have taken their lives over the past 2 years. Yeah. It's horrendous, man. And so this guy actually called you, though, and you barely spoke.
This was how bad it was for him. I guess he hadn't left the house and spoke to people. When I didn't know who he was straight away, he was that sort of shy that he couldn't even speak to me on the phone and be like, dude, I need help. And I know that, because when I've called Samaritans, when I've been like, oh my God, I'm going to take my own life. Like, it's weird. Like, I don't know this person at the end of the phone, and what they're going to do. Again, they can't offer advice. And again, I'm not saying they're not good for some people, but for our situation, where we know, at least at the moment, that it's not going to go away. This isn't a breakup. This isn't grief from somebody dying, which is, I'm not trying to undermine as well. This is like, I know every day is going to be painful if I continue. So on a bad day or a bad week, what am I meant to fucking do? And then my mind's not trustworthy, because I'm like convinced that there's no way out. And so it's very difficult to hear anything else or be connected to anything else. And it just feels so alone.
Yeah, you're spot on. I mean, very well said. You feel so isolated with this. And you feel like, there's nothing you can do. There's nowhere to escape. I mean, I don't know if you work out, if you exercise. I do that. It's become more of a little bit of an escape recently. My body has kind of healed to a certain extent, where I can kind of get the endorphin rush to a certain extent. Yeah. But it's short lived, and then afterwards, I'm kind of just back in my my space again, where nobody understands. Yeah. So I can relate entirely to what you're going through, Stefan, and I think a lot of other people can too. I know a lot of other people can. And I think this is more common than we even give credit for, because I think there are a lot of people probably suffering with issues like ours, maybe not to the fullest extent, but who have taken finasteride or who have taken Accutane, and they just haven't connected their symptoms to the medication yet. And that's why I think it starts with awareness. Awareness is so important. I think once the floodgates open, which I think inevitably they will in the upcoming years, because so many people are speaking out about this, people are going to start connecting the dots and realizing, oh my God, I took Accutane 10, 15 years ago. I've been dealing with symptoms since around that time. which is why it's so important to speak out and talk about this. But going back to what you're saying, you're far from alone, man. But I just, my heart goes out to you because I deal with it all the time myself.
Yeah.
I know a lot of other people do. And it's honestly, doing moral medicine and doing interviews for myself has almost been a way to cope in some sense, because I'm talking to people who can relate to exactly what I'm going through. So it makes me feel less alone. It breaks my heart that so many people are experiencing this.
Yeah.
But it's like, I guess I'm not as alone as I once thought, you know?
Yeah. Yeah. And I would encourage anyone who's a little bit on the fence about, not a lot of people aren't comfortable being on camera and opening up. But I feel like this is one of those things. I mean, you see adverts for Google. I'm like, who doesn't know about Google? Or you see people raising awareness for testicular cancer, but people know about that now.
Right.
A lot of people do not know about this. And so the people that are afraid, they don't have to, but it would be helpful if they could find the courage to join us and come forward about this, because it might put some people off. It might protect some people from what, and imagine there's a small chance that someone could have put us off. We would have wanted them to do everything to tell us not to take these medications.
Right.
And there are people with, much more minor cases of acne who have had their lives taken, and the regret they must feel, because maybe the alternative, I would have still, I don't know. I don't see many people my age now, 34, who are covered in acne, maybe scarring, but but you're right. It's not worth kind of pondering too much about what might have been. Maybe depression strikes a lot of people. I might have not had a perfect life by any means, but I would have a normal functioning body to a degree, I expect, which I don't have now.
I think for me, it's kind of about leveraging the suffering, because it's like, if I have to go through this, how can I leverage this to make the world a better place, right? And like you said, maybe somebody sees your video here and they decide they're not going to take Accutane now because they don't want to take the risk. Which, I mean, in my opinion, I wouldn't say the entire thing is worth it, but the fact that you shared your story was worth it at that point,
Yeah.
And I really appreciate you touching on the whole idea of just going public, because I tell everyone, the one thing that anybody can do today, and it's free, obviously, and it only takes about 20 or 30 minutes, is to make a quick video that you can send to us. We'll do the editing. We'll post it for you.
Yeah.
Can you imagine if every Accutane sufferer and every PFS sufferer and every PSSD sufferer did that? I mean, there's no denying it at that point. That's thousands. I think, honestly, over 1 million people would be dealing with this. That's what we realize. So it's a very easy thing to do. It's not easy in the sense of it's a little uncomfortable to share your story publicly. I get that. But if you're one in 1 million people who have shared their story, you're not going to be pinpointed down. You're not going to be the guy who everyone can just point at and say, look, he went public. It's like, yeah, he went public along with 1 million other people. So you feel less alone in that sense,
And I agree. I think no, sorry, I had a point. See, this happens obviously.
It happens to me all the time, and I get it. You're completely fine.
The point's probably gone, but to be fair, I think we have covered a lot.
Yeah, for sure.
And again, just want to encourage people to try and stop these guys making so much money. Again, I know some people will be very favorable. Oh, I remember what I was going to say.
Sure.
I was going to say, when people actually hear these stories, because obviously I have watched quite a lot of the videos you've put up, it's so obvious to me these people are rational, self-aware, like not just imagining this shit. I'm not imagining this shit. And I know one of your questions sometimes is, do your friends and family believe you? And mostly for me, I would say no. I think if anyone, my mum is the one I'm most open about, but other people like my sister, my dad, just think this was the way I would always have been, just a little bit sensitive to the world, just a little bit mentally unwell, even though the rest of my family, there's no case of any mental illness. And you could argue everyone gets depressed at times, but actually getting stuck in it where it's like, this is just who I am now. I don't know anyone in my family who can really relate to me on that, because I don't think genetically I was destined to be this way. But yeah.
No, well said, Stefan. I mean, it's I talk to guys all the time. I say guys in particular because I talk to a lot of PFS sufferers, and they won't even tell their families about this. Their parents, their siblings, because they're afraid they won't be believed. And some are actually worried they'll even be sanctioned.
Jeez.
That's horrible. I mean, that's a horrible prospect, and that's why I tell everyone to show their family this channel, Moral Medicine, because I mean, I've been just as shocked as well when I've had people like, I had a board certified anesthesiologist reach out to us, a medical doctor who has PFS. We've had multiple school teachers reach out to us who have PFS. I had a military veteran who received an award from President Barack Obama at the White House for his service to the veteran community. Doesn't have PFS, but he took finasteride, got damaged by it, and then recovered. But it's like these aren't, again, basement dwelling millennials, living at home with mom and dad at 35 years old, who are talking about this, who have never had a job. These are really high caliber professionals, and that's where I feel better, seeing these people step up and talking about this. And I think we're going to see a lot more in the upcoming years, both with PFS and PAS and PSSD.
Yeah. And all it'll take is, there could be some out there already that are just too afraid to go public, but footballers or celebrities that instead of getting a hair transplant, which is obviously quite popular, will go on this drug. I've heard, I don't know if this is true, but off the top of my head, I've heard that before Wayne Rooney, you may know of Manchester United, an England player, very well-known player, before he had a hair transplant, which doesn't look very good now. And I think if you're going to have that done, you have to have multiple, right? Because your hair might still recede and go thin.
Right.
So, not everyone will look good bald, but I think when something like this happens to you, you realize that hair is... Like, you just wouldn't give a shit, would you? Like, you would rather shave your head right now and have your life back, obviously.
100%. I tell everyone all the time,
over a limp dick or whatnot. And again, for me, that, like, a lot of people do get erectile dysfunction, but for me, it's more the brain connection not working. Like, I can function now, and there was a point where I probably couldn't after and maybe during the drug. But it's also weird, again, because I was so young, I hadn't ever had an actual sexual relationship with another person, so...
Right.
It's hard to kind of gauge what's normal in that sense, isn't it?
You don't have a good baseline. You didn't really get the chance to experience what it was like to fall in love and have a sexual relationship with somebody. And that's where, PSSD in particular, they're giving SSRIs out to kids as young as like 8 or 9 years old, from my understanding. That during their sexual development phase, they'll never know potentially what it's like to experience what.
That's so insane, by the way, because in the UK,
crazy, dude.
You have to be 18 in the UK, but to think an 8-year-old's depressed, like, what the fuck?
Oh, it's disgusting, man. I try to keep my opinions to myself about the medical system as a whole, especially during these interviews. But it is disgusting that they are prescribing these medications to young kids like that. But even Accutane, taking it at 14, 15 years old, you're still in the stage of developing, obviously.
Yes.
And so. Yeah, you just don't have a baseline to compare it to. And, you mentioned the hair transplant too. The thing is, for a lot of people, when they get hair transplants, they still have to take finasteride before and after, typically, the transplant to keep hold of those transplant hairs. So that's not always the case. I don't want to give people medical advice. I've talked to people who have gotten hair transplants who never took finasteride. That's great.
Yeah.
But to your point, I would give every follicle off the top of my friggin' head right now if it meant my body is going to go back to the way it was and I'm going to be healthy again and have my neurological abilities back. Dude, I love to work out. I'll rock the bald head. I got a good beard.
I saw your really old videos as well, because you in, I think, your first video, I thought, let's just have a look if you looked or sounded different, but you were in amazing shape. I think you were genetically or athletically sort of gifted in that sense, because even if I'd have worked out, I wouldn't have been able to look that good. But even now, obviously, you still look good, but you know that you have lost a lot of what you had before. And some people look at you and think, well, again, they don't know how you feel on the inside, but they'll look at you and go, oh, he still looks healthy and well, and he still can go to the gym. But you know that you were at a different level before entirely.
I appreciate that. And this is where it's interesting, because I think genetically I was kind of gifted when it comes to bodybuilding. I've been natural my entire life. Right. Yeah. And I think that's honestly that almost coincides, or I guess there's a correlation between people that get hit really hard with PFS or PAS and people who are naturally super androgenic, right? Who have high testosterone.
Makes sense.
Because even now, I've lost muscle, I've lost weight. I don't have the same baseline as I once did. But I was able to put on muscle very, very easily before. And it changed in a matter of just a month or two after I came off finasteride. So I do think there's a correlation between highly, androgenic people and people that get hit extremely hard with this. I'm not saying that's always the case. That's what I've seen. So anyways, hey, Stefan, we've been talking for a while here, man. This has been more of a podcast, which I really appreciate. Before we jump off, do you have any closing statements you'd like to make?
I'm just really grateful to yourself, because it is a lot of responsibility to run a channel like this where you're having to relive a lot of this stuff. And I think that you're a really bold commentator on this, and people will look at you and go, this guy's not fucking crazy, and he's not a dweller of the basements. So I'm really grateful that you're doing this and that you've had me on, the first person to talk about Roaccutane, or Accutane. And I look forward to seeing more videos, not really in a way, because obviously it's more people who have been affected, but this channel's going to take off. I know you started it about a year or two back, and it will grow massively. I know it will, because this is something that's affected so many people. Amongst these different drugs, they're very popular drugs, so everyone come out, and I look forward to seeing more people, putting an end to it, really.
Absolutely, Stefan. Really well said. I really appreciate the compliment as well. We do work hard over here, so we want to see more people step up and share their stories. So, Stefan, thank you so much for jumping on the channel, man. We'll see everyone next time.
Thank you, Mark.